All right, the world's most redundant podcast intro. Here we go. You are about to enjoy a Firearms Radio Network podcast. The views and opinions expressed in this podcast are those of the individual co-hosts and do not reflect the official policy or position of the Firearms Radio Network and or their employers. Viewer discretion is advised. This is especially true on live shows. If you like what we're doing and would like to help support the show, visit patreon.com/afteractionproject. If you'd like to throw us some free support and appreciation, we would greatly appreciate a 5-star review on iTunes. And then tonight's episode, just like every episode, is brought to you by the Firearms Radio Network. Be sure to check out the other great podcasts on the Firearms Radio Network by visiting firearms-radio.net. Your hosts, as always, are myself, Jeremy Gill, Andy Montoya. Give me 1 second. Just getting a little error right here.
You already broke it.
I know. This is it was just saying it was having some trouble connecting. So I just want to make sure we are actually doing the live thing. All right, cool. All right, back to your regularly scheduled podcast. Tonight we are joined by Johnathan. All right, let me do that again. Tonight we are joined by Johnathan Willis of Gunset Training Group, and we will be discussing their real-world trauma course. Man, I'm so glad I can edit all of this stuff out and post, and it takes people a few minutes before they jump on to see all the blunders and all that other crap. And I actually think I had a typo in the deal, but I'll fix it all in post. Awesome. So, son of a bitch, man. What a way to start the show. Sorry, guys. I swear I've done this before. Oh, shoot. All right, cool. Hey, guys, thanks for jumping on and joining us today. To our viewers and listeners, thank you guys so much. Really appreciate y'all jumping on. Before we get into the show, hopefully this will help me reset my mental train and get it back on track. I want to talk briefly about the RangeBuddy.App. It's a collection of over 130 shooting drills that are all sorted out by the required target and filterable by the skills work. So if you want to work on like draw to first shot, multiple targets, transitions, all that good stuff, you can sort the different drills by the individual skills that you want to work. It has the only virtual instructor program out there that I'm aware of where, it's just like taking your buddy out to the range. So, for example, this past weekend, I was out at the range by myself because Andy, my only range friend, was off training with some unknown instructor. So I took the RangeBuddy out. I opened it up on the phone, and I was able to have some fun and bring a little bit of enjoyment and challenge to my range session. So be sure to check it out on Android or iOS. It's the RangeBuddy.App. But let's get into what you guys are joining us for. We're going to talk about the real-world trauma course offered and put on by Johnathan Willis of Gunset Training Group. Go ahead, Andy.
Real quick, I want to talk about the RangeBuddy with you. You didn't give me an opportunity to help plug the amazing app you have, man.
I just want to stop talking.
Obviously this isn't his show, but we're going to have him back on. I did train for mastery with Tim Heron and AJ Zito this weekend. And a lot of this class was based on logging data, right? And logging performance to where you can go out, you practice one part of your training regimen, whether it's accuracy, gun handling, speed, whatever it may be. Well, Jeremy, on the RangeBuddy app, if you use these drills that you have on there, there is a location to log your information too for future reference in the future, to where you can future reference in the future. See, I do it too. So you can log your information and be able to track your progress, right?
Yep, absolutely. It'll also show you how you compare to some other folks. But that training thing is one of the deals where, I think it came from a range session that we were at. We had just finished up on the range, and we started working on some build drills. And I was like, man, I don't know what I'm starting at, right? I don't know if I had any improvement over the last time I shot a build drill. So that's kind of how that feature was born. So check it out, RangeBuddy on Android and iOS. Johnathan, welcome back to the show. Really appreciate you jumping on with us today. We had you on as a student guest a few weeks ago. Had a great conversation then, so I'm really looking forward to the conversation and the knowledge that you'll be sharing with us today. So introduce yourself to our listeners. Talk to them a little bit about what got you into the firearms training industry and what the heck is a real world trauma course all about.
All right. Well, I'm Johnathan Willis. Thank you for having me on. I appreciate you guys, your interest in this program and what we've been able to do over the last about 15 years with this program. I created, I teach with Gunset Training Group here in Dayton, Ohio. I'm obviously the lead trauma instructor, and I'm also the lead shotgun instructor for Gunset. We offer a lot of regional classes and sometimes get around into North Carolina and some other places to help do some training with some of our friends. As far as what got me into the training industry, it's actually because of real world trauma. I was training a lot with kind of the usual suspects around Ohio, Tactical Defense Institute, handgun combatives with Dave Spalding and things like that. And kind of my first nod to do this in the firearms community was through Dave Spalding. And I taught it for a few years with handgun combatives and was able to travel around and kind of get my feet wet in the firearms industry. I didn't come into the gun world because of my background in gun skills. It was all because of the trauma work, and the gun stuff kind of came later. So that's a little bit about how that came to be and how I came into the gun world. And now fortunately I've been able to work with a lot of great people and really kind of expand my horizons in that way too.
Johnathan, tell us a little bit more about that. So what is your background as far as trauma?
So I was on the streets as a firefighter paramedic and eventually left in 2018 as a fire officer. So I did that professionally from 1998 until 2018. Now I'm still certified, and I still teach a lot in technical rescue world and things like that. But it kind of came out of that, just being a street level paramedic and seeing a great void that was going on in the gun world as it pertained to the training of civilians in the trauma in the realm of trauma care from a civilian context.
And it's interesting that you say that. Andy and I have both taken a civilian trauma level course. And one of the things that I'm sure you teach or you talk about in your class as well is, man, you're far more likely to need the medical stuff than you are the gun stuff. And there have been a couple incidents that I've had, at work and, in traveling where, it's not the tourniquet that came out, right? But it was gauze and how to properly apply pressure to stop the bleeding. How to identify, hey, I was able to recognize that, oh no, this isn't a tourniquet situation, but it is pretty severe bleeding. So let's get pressure on there. And Andy, a few months ago, he called me and he was on his way down to teach a class, and he rolled up on a motorcycle accident, and he was able to get out and assist and help render aid in that situation. So really looking forward to the conversation. Before we get much further into it, Frank, introduce yourself to our listeners and talk to us a little bit about your background in the firearms industry and what got you to the real world trauma course.
Thanks for having me. My name is Frank Horvath. I am a instructor with Apache Solutions. We're based out of Yadkinville, North Carolina. I have been actively teaching for the past probably 5 or 6 years. I've been training since I turned 21, really. I didn't start, my journey as far as, firearms education or anything like that with the purpose of becoming an instructor or anything like that. It just kind of naturally happened. I think Tim Kelly's been on the show. I'm right there with him. We do quite a bit of training and quite a bit of work together. We have a broadcast radio show now. It's the Responsibly Armed Citizen, where every week we get together and talk about what we believe the responsibly armed citizen needs. So we're trying to reach out through the airways and talk with people. Gunset Training Group is I would consider them a sister company to Apache. We're constantly, as far as culture goes, as far as just, how we, view the world and how we go about things. We're very much like-minded. And, it was because of that, we were able to, reach out to John to talk about real world trauma when, we were, looking for some help. John's class specifically, it was kind of interesting how it all unfolded. It wasn't geared toward a bunch of gunslingers at all. It was actually geared more towards a church group. And so that dynamic of, hey, this is a firearms instructor, a med guy who's coming down and teaching this to a bunch of, civilians, a bunch of people who really don't, they're not necessarily like-minded in the sense that I would say that we are, as far as, how we view our personal protection, how we view, the necessity to, have a mastery of the tools that, we choose to use. But it was kind of neat how, John has that ability to kind of mend those worlds together and kind of mend, work all that. And I think we'll talk a little bit more about it later, but yeah, that's a little bit about me and a plug for John.
Awesome. Hey, with most of our firearms courses, we talk about gear, like the gear list. Hey, what kind of gun do I need to show up with? But in that same vein, Johnathan, what's the required gear to take the class, man? What do I need to show up with, if anything?
Fortunately, there's none. And actually, I encourage people to either, one, bring nothing, or two, bring a kit that they think they've constructed, and we can spend some one-on-one time with people and their kit selections they made thus far and see if they were really on point with what they needed. I try to empower our students with the knowledge of what they can use to get the job done. With my 20 years on the streets as a medic and then as a fire officer running an engine medic company in a pretty busy area, a lot of times we had to improvise. So I try to empower kind of from the context of the everyday civilian. Here's some critical things you may want to get. Here's the ones I prefer, and here's why. And I let people get their hands on good stuff. And usually people will go away with kind of a buy list. But I also spend a lot of time teaching people skill sets using no gear. So we're kind of all over the place with that. But as far as anyone coming into the class, if they came in with nothing but an interest in the topic and an open mind and a willingness to learn and take in the content, then they're going to have a great time.
I'd like to stay on a little bit about the gear. I'm in quite a few Facebook pages. Obviously, one of them is a camping page. And there was a guy that put together kind of like this quote unquote survival kit, right? And it was like $20. And it's got a little bag, comes with a Bic lighter, some cotton balls, a really cheap made in China foldable knife, a mini boo-boo first aid kit. And I kind of mentioned, and I was like, hey, you should add a tourniquet to that. That's the only thing I mentioned.
Yeah.
And I got a response right away. And he said, well, I'll add a tourniquet for $5. Ooh. And I said, well, no. I don't think you're selling what you should be selling to people, because there is no tourniquet out there worth $5 it's worth buying. So right. Johnathan, I want you to expand a little bit on gear. It's almost should be common sense, but with that conversation I just explained, there's a lot of time it's really not. People don't know what they don't know, as with guns and everything else we do.
Yeah.
So talk about gear and the importance of quality gear.
Well, it's a great thing you bring that up. I'm going to ruffle some feathers with a lot of things we're going to discuss tonight. And generally speaking, a lot of the things that have been marketed out there to people, as far as pre-made kits and things like that, for the most part have missed the mark for a long time. Now, I think TACMed Solutions and North American Rescue have really sorted that out. And most people kind of fall into either of those two camps for quality gear. There's a lot of bad gear out there that's specifically marketed to people who haven't taken classes from people like like myself or Greg Ellifritz or Caleb Causey or any of the other people out there putting out quality content. So a lot of folks, you know how those ads pop up in Facebook and things like that. There's a lot of companies out there pushing absolute dangerous garbage that people don't really understand. So for me, when I build kits, I have finally gotten to a point where I trust the kit construction of both TacMed Solutions and North American Rescue, and those are two totally different camps. You know, usually people pick one camp and just side with that. I recognize people are going to kind of gravitate to this tourniquet versus that tourniquet and prefer this compression bandage versus that. So I've evaluated pretty much everything that's on the market, and those are the two places I really trust gear from. I try to get people just across the board, just to know where to go to get good stuff. And I try to steer people away from that temptation to buy a quantity of bargain priced garbage off of Amazon. You know, that's a big focus for me. At the same time, I try to focus on helping people understand what they do need, what they don't need, and what should fall within the civilian bandwidth.
On the opposite side of that, Johnathan, would you say it would be a good idea to buy some of that cheap stuff on Amazon to train and practice with?
I generally don't, because I've actually, say for example, I happen to be a cat tourniquet guy. I've trained with every tourniquet pretty much on the market. I have probably pretty strong opinions about all of them. I train with what I use. So, for example, like tourniquets, my training tourniquet go-to is a bunch of old cat tourniquets. You know, it's ones that I've cycled through over the years, and I'll deem those as training tourniquets and put those in the training rotation. I think you can say, for example, with the cat, there's so many close copycats. You could dedicate them to a training role or a practice role, and that would be a valid way to designate them, as long as people understood that was not to be mixed with real world usable gear.
Yeah, and you know, taking it back to the class, something I think that's really important was, you know, John was able to say, actually in one point of the class, John was able to say, hey, you know, bring out your bags, bring out your gear, bring out the tourniquets, bring out the stuff that you have. Let's take a look at it. And so, you know, Zach and I had pulled together. We brought a bunch of junk, you know, just stuff that we know was garbage. And we said, hey, what about this? Hey, what about this? Hey, what do you think about this? And John was able to say, you know, that's a zip tie. That's just going to break and kill somebody. That's, you know, this is garbage and this is why it's garbage. You know, so he was really able to break down the specifics of, you know, he says he's a cat guy, but he's able to say, well, you know, these are the tools that work well. This is why these tools work well. This is why that garbage is actually garbage and why you shouldn't defend your life.
Right.
It was an absolute valuable section, especially to the audience that he was, you know, in that particular class. That was absolutely valuable because they had no background. You know, the information he was bringing to them was virgin. It was brand spanking new. So it was a real eye opener for a lot of those guys and gals, because you know, they're going in just saying, oh, I'll just hop on Amazon. I've heard of tourniquets before. You know, we'll just grab, you know, the first thing that pops up when I type in tourniquet. And, you know, John was able to, you know, just shoot that bird right out of the sky real quick.
Yeah, the Amazon tourniquets, I'm still a little bit amazed that that's still a thing, because you're saving $5 or $10 by purchasing through Amazon compared to if you went through North American Rescue or TacMed or a reputable supplier where you know you're getting the legitimate deal.
Right.
So I'm just like, man, it is super convenient to be able to open up your Amazon app and, you know, add it to your cart and check out and all that stuff.
Yeah, and a lot of times I'll toss out to someone what was the one that got sued recently, like Recon. I'll toss out a Recon tourniquet or some other copy of a cat. Yeah, copycat. I'll toss out a copycat and like see if people could even begin to tell the difference after having hands-on, and a lot of times they couldn't. and that's unfortunate. So certainly they're not going to be able to tell the difference when they're shopping for a package of 5 of them on Amazon for 20 or for $30 instead of one for 28.
What I guess I was wanting to ask this a little bit later in the show, but talk to us a little bit about the minimum recommendations that you would have for somebody to carry with them, either on their person or a short jaunt to their vehicle.
So I like to encourage people for a minimum is a tourniquet, because that's the immediate action tool. That's the thing that has to happen right now. And I've thought for a long time about what has to be on a person's person. And that led me to really put a focus in the class on the immediate actions of a person with no gear. So I do spend a lot of time, let's say that bleeding injury pops off. I like, here I am, here's my Yeti, I teach people how to pressure point with Yetis and things like that, or how to stop bleeding with things like that and direct pressure to stop arterial bleeding in the immediate action. So I spend a lot of time on that too. But generally speaking, I roll with a lot of kits on me. So my minimum is I admittedly like the gear from NAR the best. Although in the compression dressing and the wound packing realm, I do like a lot of the offerings from TacMed Solutions because they tend to lean more towards a portability than North American Rescue does. And I think that's awesome. So my big focuses are tourniquet. If that can be on person, that's the thing that's on person. I don't care if they carry nothing else on their person. Tourniquet is the thing. Really focus on methods of flat folding. I carry a cat tourniquet flat folded with a Ranger band around it. I don't put it in anything. My next favorite thing is the last generation soft T tourniquet in the Filster flat pack, Pete. I think it's literally called that or something like that. The Filster flat pack device that they offer. That's the smallest one. I actually can't stand the new soft T. So I like a tourniquet on the person. I really don't like most of the offerings for low profile carry that have been built and designed specifically for that. Next, I would say the compression bandage. There's some great offerings from TacMed Solutions and NAR for that. I like the emergency trauma dressing from NAR. So usually I carry that. I carry straight up gauze. I don't carry hemostatic gauze. I think a focus on proper wound packing rather than a focus on hemostatics is more than adequate. If people pack well, it usually offsets the difference of hemostatics versus non-hemostatic impregnated gauze. And then beyond that, the next thing would be a chest seal, and that's pretty much it. And chest seals, it's one of the few things that I fully endorse improvising. Everything that else comes in a package that's non-permeable in nature, there's your chest seal. So even if you just understand how to do that, if I may kind of explain a little bit of my contextual point in this, is that cool with you?
Yeah, absolutely.
I think when we really started teaching people the trauma management in the civilian or real world context, and that's the focus of my class is real world. Most of the good data and a lot of the good science coming to us of how to treat these traumatic injuries came from TCCC and in the areas of war and combat. So almost every intervention we were learning was how to set it and leave it. Could we seal it, do a chest seal and walk away, hence vented chest seals? Could we set in a tourniquet and expect it not to come loose? And we were able to do that. And then the people were able to continue the mission that they were involved in. In the civilian context, we're less concerned about setting something or putting into place a treatment and then leaving it. So that's where it becomes more realistic to say, oh, the package that my trauma dressing came out of is a big, beautiful square piece of plastic. I can stick it on a person's chest and use my hand or their hand or whatever to maintain it until definitive care arrives. So that's a big focus of the vision of my class, is understanding real world trauma is inherently not a gun battle. It's not a protracted area of combat. It's someone is on a sidewalk because they just got hit by a car and you're waiting for EMS, and it might be 10, 15, 20 minutes, and then things are going to happen. So that's where my class comes from.
No, that makes sense. And I'd imagine even if it started off as a gunfight, you're going to render aid when it's no longer a gunfight. So there isn't the need to walk away. No, I appreciate the clarification, because I was going to ask you, I was like, man, everybody talks about tourniquets. And it's always in the back of my mind, and is this thought. It's like, well, what happens if somebody needs a chest seal? We're not talking about chest seals in the industry, and that makes sense. And you can make a chest seal out of just about anything. Yeah. Right?
Mm-hmm. A hand is a non-permeable. Your hand, boom, chest seal.
Is a chest seal. Perfect. And the venting, right? Is that something that somebody needs to be worried about?
Again, I'm going to ruffle feathers, and people do tend to disagree with me. I've written a lot of articles, and people have not liked some things I've said. I don't care. In EMS, I learned I was in the Navy back when, Asherman created the chest seal. I'm back then. I've never been that trusting of the venting mechanics of a chest seal, because I've been around injuries with the fluids and the realities of violent trauma. And when I say violent, I don't mean trauma from violence. I just mean the forces applied to the human body. I couldn't care less. I'm good to go with a straight up non-vented halo all day. It doesn't matter to me, because I know I don't have to leave them, so I don't have to rely on the venting aspect of a theoretically operating vented chest seal. You know what I mean? If I see a bulge, then I understand, or the symptoms of a developing tension pneumothorax, then I know just to peel it back and burp the chest seal, release the pressure, and then put it back. I don't need to be in a gun battle. I'm treating my patient. I'm hanging out until the medics on the box show up, and then they go to a trauma center. That's the real world of work for any of us. So I'm really going to be in the civilian context. I'm going to be sealing a chest wound just because it's a hole in the chest wall, and I might as well. I won't probably be in contact with a person long enough for there to be the concerns of a tension pneumothorax having on set. You know what I mean? So I don't care about that stuff. I just as soon use my favorite tape is Gorilla Tape. I love that stuff. So I just as soon use Gorilla Tape in a package that my emergency trauma dressing came out of.
Nice. So on ruffling feathers part, you often hear a lot of the common misconceptions. And so do you cover like common things that you hear on the interwebbies, using a tampon to plug wounds, stuff like that? Do you cover items like that and kind of give us a little bit more detail?
Oh, absolutely. These are things that have spread as common lore across this, and it's trickled down from people who heard a story from a dude who told a story, and almost universal. Well, I'll say it universally. It's bullcrap. And I was teaching a class just Friday, and I told that I was doing a bleeding control lab, and I told them, I said, have any of you ever heard that a tampon's good for a bullet wound? And a bunch of heads shook and everything like that. And I said, how many of you have ever shot a bullet into or seen a bullet wound in flesh? And a couple of hunters, of course, raised their hands. I'm like, was it as big as a tampon? Like, where do you think it goes after you put it in? Like, so I try to dispel those myths, but at the same time, I try to tell them, really handy things to have. Am I allowed to say the S word? Am I allowed to?
Shit, yeah.
Okay, cool. I'll talk shit about people who say using a tampon for a bullet wound, and in the next breath, I'll tell them, but when you build a kit for your family that's going to be in your minivan, you need to have things that everyone could need. And if you have a female in your family or loved ones who are female, have extra maxi pads, because I use maxi pads all day for trauma dressings. So you try to get people to stop or to understand what is bullcrap, and then tell them some out of the box kind of things that they can use that are realistic and viable options in these horrible times.
The class we took, Jeremy and I, obviously the tampon thing came up. And then, of course, I'll stay on the tampon subject. Our instructor was like, I'd prefer you grab your dirty, sweaty sock and use that as a place to stop bleeding than I would trying to stuff a tampon in a bullet hole kind of thing. So those were good. The other one, real quick, if you don't mind, because I think it's another one that I hear still pretty common today on tourniquets. Actually, I have two. Do you put a tourniquet on, release it after a little while, put it back on? And then the second one is, stick with that one because I lost my train of thought. Stick with that one, and then I'll give you the second one here in a second.
So the data that we have, it talks about kind of an extended application of a tourniquet. And again, that data and those experiences come from theaters of war where extraction was delayed. So generally speaking, for us in the real world, dealing with real world trauma, there's little to no situation we could find ourselves in where the application of a tourniquet could cause any extended or even have a potential for a long-term injury because of it that would supersede or need released because you have a buildup of carbon dioxide, all this crap. The release of a tourniquet isn't going to be a realistic thing in the civilian context. So no, the answer is no. You don't really need to think about that in our world. The biggest concern is that of a transient nerve palsy. And in that case, I'd rather have a transient nerve palsy than have bled to death. And I certainly don't want someone releasing a tourniquet that might blow off a clot or circulate a giant pool of what we would call acidotic blood back into my body through recirculation. So I'm not about that. And for the people I'm trying to teach, I want to put this in the simplest terms. I want them to think, like TACMed Solution says, tourniquet the limbs, pack the junctions, seal the box. I don't push, tension pneumothorax release or anything like that, needle decompression or any of that crap on the civilian masses. I want people to learn 3-4 super basic techniques that they are truly capable of embracing and internalizing in an 8-hour class. And that's good. That's my goal.
Awesome. I remember the second one. The second one was high junctional tourniquet versus immediately above the wound. And then I'll kick it over to Frank and just ask him if he has any that he can think of that you taught in the class that maybe we could add to the list.
Yeah, again, for simplicity's sake, I do still teach people the high tourniquet application. There's science coming out saying that we can go lower limb and everything like that. I don't need people in this as a force multiplier. If I teach a bunch of civilians how to put a tourniquet high on limbs, thereby isolating the arterial blood flow to that affected limb, then I don't have to worry about them missing the mark or being too close to it, or missing a high wound close to a junction. I don't have to worry about that if I just teach them that simple technique. And there's some people who are talking about putting them lower and things like that. And I think I think in a lot of ways that's muddying the waters for the general person to take in. That's just been my experience. I just try to keep it as simple as possible for them. I talked to my wife a lot about this. She took my class a couple of months ago, and I kind of try to put it in terms that she gets, and I talked to her about it. And if for some chance or for some reason it seemed confusing to her, then I generally accept it that it would be kind of confusing for the masses, and generally steer away from it.
Well, talking specifically about, when John came down and, taught his rural trauma course, for this other group, he wasn't talking to gunslingers. He wasn't talking to people who, were actively trained or anything like that. He was literally teaching everyday average civilians, some of which didn't even want to be in the class. They decided to come and take the class because, somebody told them they were voluntold. They were told, hey, you're going to be in this particular course because you are. And, one of those people who ended up walking away from the class, to this day, and John and I haven't talked about this yet, but to this day says that John probably changed his life. He walked into it disgruntled, thinking, man, I got to be here. I have to sit here and listen to this guy for, 8 hours. I don't care anything about this, to now this dude, I just saw him this past Sunday, carries a tourniquet with him everywhere he goes now because of that. And it's because, you don't know what you don't know. And, part of that, the way that John was able to, relay that important, somewhat, it can be technical information in such a clear and concise way that the average, Joe can clearly understand. It makes a lot of sense. Breaking it down, instead of using, using particular terminology, what it actually is, say something simple like, put it in the armpits, put it in the cockpit. That's as far as, dealing with tourniquets, just something that, really helps break it down to where it's quick, it's easy to remember, and, it's going to be something that they can immediately go to. Going back to that course, there's just so many good nuggets throughout the entire day. And, the pieces that really stuck out to me were the things that, I've seen before, and albeit I may even be a little desensitized to a lot of it just with my own research. But the way John goes about showing real world trauma and, in its entirety, that's a real eye opener to a lot of people. They think, oh, that's not going to happen to me. That's not going to happen. I'm not going to come across something like that. Then John really starts to break down. Okay, but here's an example of X, Y, Z. Here's an example of this. Here's an example of this. There's a tree sticking out of this person. It's all things that can happen. Again, not in a theater, not in an active war, or even some sort of hijack. Like it's somebody riding around their backyard and something happens, or riding up and down the road, something happens. But let's see. Going back to gear, we were kind of talking around a little bit, but the what do you think about you talked about like the 3 or 4 important things. Are there any other widgets, items, things that the average person doesn't necessarily need in their kit, or if it's in their kit, they should just get rid of?
I would say a needle decompression kit, tension pneumothorax. Most people couldn't tell you the indications to do it, and thereby certainly couldn't tell you the contraindications to do it. And that's the one I see the most that I'm like, just stop. I've put a lot of needles and weird shit into people in a lot of different ways. And that's a huge failure potential that there's a lot of people that are carrying that around that I know I could put into. I could call them out and be like, put a tourniquet on now, go, pack this wound, just put a simple dressing on, and they'd probably, our favorite expression from Tom Givens, fiddle, 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 right? They'd probably mess it up. So the probability of them understanding the landmarks and the points and if they're going in the different positions to do it or understand the or the indications for it, I would say that's the most over-present piece of kit that people are pretty much never going to use, or they're carrying it. And I've asked some people, because I'm that guy. I'll walk up to somebody and be like, hey, what do you got there? All that. And I'll ask people, oh, what's that for? Where are you going to put it? Tell me the indications. Tell me the contraindications. And then it's just like blank stares. Oh, man, I don't know. And then it goes to, I carry it in case someone's there who knows how to use it, which is always a funny response.
You're carrying it because you think it makes you look cool.
You're carrying it because you want to look cool. And I've heard I carry it in case someone shows up who knows how to use it more times than anyone's ever told me an indication or a contraindication to do it. Right. In my world, in my world of work before I wasn't on the streets, and I'm still a medic. I'm just not on. I don't work for a department anymore. I still do technical rescue. I still teach and train all of this stuff, and our indications to do a tension pneumothorax relief, like if they had a radial pulse equates roughly to a 90 systolic blood pressure. If they had a radial pulse, you can't do it. If they had, some decent level of breath sounds, you can't do it. Well, if you're on the streets and you have no stethoscope and you have no real knowledge of understanding vital signs or lung sounds, how are you going to decide to do this? It just doesn't make sense. It doesn't really add up. And a good instructor told me many, many years ago, when I was coming up as a paramedic student, he said, when you get out on the streets, the more shit someone has on their belt, the less is going on in their head. And he was talking about those EMTs and paramedics that wear a stethoscope around their neck and have like trauma shears in both pockets and all this stuff. And he said, if someone has a bunch of gear in their pockets, on their stuff, that's less stuff in their head. And that's kind of what it translated to when people started carrying medical gear. Master the basics, tourniquet, wound packing, maybe a chest seal and some dressings, and that's it. That's what you need to master. And then we go well beyond that in real world trauma, because there's so much more to real world trauma than just that. That's the trauma component. But that's the one piece of kit I see people carrying that I'm like, oh, I'm calling BS on that one.
Yeah,
it's also
Sorry, go ahead.
No, go ahead, Frank.
I was going to say we go as far as when we see guys over bring kit, and especially like IFACs or something like that they wear on their belt, a 1-day pistol shooting class, that's teaching you how to grip stance, the basics. We'll do, much like what John does, he'll say, hey, ask those probing questions. Well, when you open up and see, oh, okay, well, that's from Amazon. Well, that's interesting. That's so what's the point of this? What's the point of carrying this? What's the point of putting this on your belt? And then we have some other people that show up that are just real squared away dudes that have, all the kit and gear, and it's because they have a background that's, similar to John's or something. That's what they do, in the real world. But I think, as an industry, in the training industry, we need to get a little more comfortable with calling each other out. If we see things like, those Amazon IFAC kits or whatever it is, that's on the range, or we see those decomp needles, get some education to yourself first, but, ask those probing questions and really help try to educate others, because we're not doing each other any good at all by, saying, oh, that's cool, and then moving on.
Yeah. And, people need to understand the Good Samaritan law only goes so far. You start messing around with really, really intense interventions that for a street level provider with years of training and experience, we still have a medical director over us saying you can do this at this exact point, and if you do this and these criteria aren't met, I'm going to hammer your ass. That's the reality of every medic in the United States who actually carries and uses a like, say, for example, a tension pneumothorax kit. The reality of the matter is that we're going to have more cardiac events. We're going to have more heat stress emergencies on our ranges than we'll ever need those advanced interventions or those really cool pieces of kit that look awesome on your belt. You know, I own an AED. And Frank, you were in the first class where I put in a really aggressive CPR component.
Yep.
I'm really big on those basics too.
Yep.
I was going to say the decomp needle is typically where the Good Samaritan protection ends, because if you exceed your scope of training, you're no longer covered by that. And if you go around sticking a needle in somebody's chest trying to save their life, you're not going to be covered by that Good Samaritan law, as I understand it. So. Oh
yeah, if you thought you were going to do a needle decompression and you end up doing a pericardial centesis with that big ass needle you just stuck in someone's chest, there's going to be a reckoning, and that law is not going to cover your ass.
I think some of that stuff comes from the movies too, right? Where you remember the old movies are pretty often where, you know, all of a sudden somebody can't breathe and they're on the phone with 911 and they're like, hey, take your pocket knife out and cut a little, you know, X in the throat, you know, so they can breathe. And all of a sudden the guy starts breathing and he gets up and can basically just walk off until the ambulance gets there. And I think a lot of movie stuff gets involved with that, and it bleeds over into everybody, you know, everybody that doesn't have the information.
Yeah. Thanks, Marky Mark.
Yeah, you don't need a pocket knife. You just need a couple old dirty keys.
Exactly. I got that video, man. Yeah, we were trained. My last 5 years, we started doing surgical cricothyrotomy in the field, and that's some horrifying shit. Like when it comes time to literally understanding the structures of someone's throat and making access to their airway, you know, through this very specific point that you have to get to, like when it comes time to do that, all the crap talking you may have done or everything you thought was cool 5 minutes ago ceases to exist. Like that's not a cool thing at all. And God forbid you're ever in a situation to have to do that, you know. It's horrifying.
Yeah, I agree. So first, before we make a segue into kind of the non-bleeding stuff and all that, the 14-year-old in me cannot let this go. Up in the armpit and then up in the cockpit. And I'm like, okay, well, what if it's a female? What do you call it then?
Yeah.
Cockpit.
Stay with the cockpit.
It's the same thing.
I guess it is. Yeah.
Yep. So bad. But anyway, you kind of our segue over into, you mentioned CPR and the non-trauma life-threatening style. Well, I can't even say that. I guess the non-trauma stuff would be the correct term per se. But I'll give you another example. So humble brag, my daughter's pregnant. She's going to have our granddaughter. She's due in December. We were at the 3D imaging place. We were standing outside taking pictures, and all of a sudden we hear this thump, ah! And we look over, and a lady actually fell. There was 2 flights of stairs.
Oh,
she made a misstep off of the top of the first flight of stairs, tumbled all the way down. You know, I dropped my bag, ran over there. A lady was basically laying on her side face down, and I started talking to her and all those things. And then, you know, I just started talking to her. She's like, oh yeah, I had hip surgery about 6 months ago and my hip was really hurting. And I'm like, okay, don't move. We're calling 911 now. Anyway, the point of that is, do you shift over? Like first half is kind of like tourniquet stuff, plug in the wounds, stop the bleed. And do you move into stuff like other things like CPR, as you mentioned, and other types of injuries, I guess?
I actually decided to put the CPR module at the beginning. And now I have a couple other modules that's added in there. because my bleeding control module and my airway understanding module is so in depth. And fortunately, science has helped me kind of reduce the airway module, and I'm able to focus more on positioning through airway. So I was able to shorten that module from some more advanced techniques we were doing back in the day, except for when I stick a nasopharyngeal airway in a random friend of mine. That's more for theatrics and fun. Sorry, Frank.
It was so enjoyable.
You took it like a champ.
Big tears.
He took it like a champ. He crocodile tears. But so I put CPR at the beginning because me and Greg Ellifritz is a good friend, and I really respect the work he does in his medical program. It's phenomenal. If you ever have a chance to take systems collapse medicine from Greg Ellifritz, you have to take it. We share a lot of similar opinions about things and reject a lot of similar notions with the same vigor. So I put CPR at the beginning because at the same time as I've been on hundreds of cardiac arrests in my life, we've kind of gotten to a point where we've talked down CPR in a lot of ways. With improvements in CPR administration and a more significant availability of AEDs, even to the point where civilians now are owning their own AEDs. Like I personally own 2. CPR results with aggressive CPR and rapid AED deployment have risen to almost 50% in a lot of studies. So I want people to understand, as a reference to real world trauma, they're much more likely to see that in their life than a lot of the traumas that people suspect they're going to see. And of course, it's technically not a trauma. A cardiac arrest is not trauma. That's medical specifically. But they're more likely to see that. 350,000 or 380,000 times a year this happens outside of the context of a hospital, and 80% of those are in a home, which means that's where it goes down. So I try to make people understand that they do have a fighting chance if they do extremely aggressive CPR. And Frank went through my literal first CPR lab that I added to my class, and it's been shockingly well received. So I actually put that at the front of my course and then get more into the weeds, because I want people to understand this isn't TCCC. TCCC is a lot of the reasons this class exists, because to be truthful, I'm kind of sick of hearing civilians talking about modalities of trauma care, CAS-EVAC and care under fire and all this stuff, when that's not the reality of the world. If you hear someone get shot in the back alley behind a stop and rob, you're not going back there to do care under fire or anything like that. You're not going back there because it's not a safe place to go. So the first intervention we all learn in every algorithm of care is scene safety. That's the first thing that is said in every, doesn't matter if it's a cardiac arrest or an advanced trauma, the first thing is scene safety. If you find yourself out there, that sucks, but you don't just go into it willy-nilly. You're a caregiver and you're able to be a force multiplier, so don't do it. So I might have lost my train of thought there, but yeah, that's where I am.
Yeah, I mean, so John was able to break down, the reasons why, real world trauma is so important, or why, why average Joes need to be taking this course, why, the stay-at-home mom, the average day churchgoer, whatever it may be, why, they need to care about, CPR, why they need to, understand, tourniquet, how to, pack a wound, whatever it may be. And, the beginning of his course, he does a phenomenal job of setting it up for the rest of the day. So saying, look, you're going to learn about medical stuff. Here's some of the medical type things that we're going to be talking about, but here's why it matters. Here's where it actually applies to you. And he does a really good job of breaking that down and going into that. For us, he covered CPR. He also and correct me if I'm wrong, John, but he tailored a little bit of our course to the people that were there, because we had gear that was there. We had purchased some pretty big med kit, and we're in a medium sized church, and we purchased some pretty big med kits from North American Rescue, and we're like, hey, our group has this stuff. It's hard to be a king in your own castle. It's hard to say, hey, come learn how to do this. It was much easier to say, hey, John, you're a good buddy. All of this stuff. Come teach. So he was able to come down and be an authoritative, an authority on all the gear, all the equipment, everything that was there. And again, more important, as important of showing everyone how everything worked, but he was able to go into detail of why everything worked the way they worked, and when you needed to use whatever it was, whether it be the AED or using CPR, whatever it may be. And we actually went off. John's CPR dummies are really neat. They're so neat that went off and bought a pair for ourselves just for kicks and giggles, because they're really not that terribly expensive. But being able to regularly practice these things, just learning a couple of simple ditties and simple things to remember, and then being able to go, okay, I feel very confident in receiving the knowledge and practicing the knowledge and getting feedback on what my application is in this in this training environment, that you can then take that and say, okay, this security team, whatever it is, we're going to practice these things. You're new to this security team, you need to know how to use CPR, whatever it is. So it's very easy knowledge to pass on, and it's accurate. Tourniquet application, it's the same thing. One of the things that we do at Apache is that every student, every beginner student, whatever they may be, they learn how to apply a tourniquet. I mean, it's something that's in their core learning. They're learning how to hold a gun. They're learning how to put on a tourniquet. I mean, that's really the minimal amount of what we're showing them, and that has been heavily influenced by John in that real world training course, real world trauma course.
I like it. Real quick, before I kick over to Jeremy, I want to, before we continue, talk about CPR just a little bit more. My wife and I recently did a CPR course as well, and there are a lot of times, if you overhear EMTs and medical professionals that are out there doing CPR, you often do kind of hear the thing of CPR, most of the time it's just theatrics, because by that time, the person's already gone and it's kind of a waste of time, blah, 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 blah. And Johnathan, you touched on this a little bit, but I wanted to go a little bit more detail as far as that statistic that we're seeing an increase of, up to 50% chance now. And the one thing that the instructor touched on for us that kind of hit home for me, because I did hear that a lot. And it's like, well, why are we even doing CPR if it's just crap other than theatrics? If I'm doing it for theatrics, the person that's watching me work on their loved one, or, they're not going to know the difference if I'm doing it right or I'm doing it wrong if it's theatrics, right? And that always kind of I always had a question in my head, but this instructor that we recently said, the reason why we're seeing statistics higher, more people are getting trained in CPR to be able to do it aggressively and get on it sooner. Because if I remember correctly, the sooner you can get on CPR and work that while your EMTs and your help is coming, your chances astronomically increases for success, right? And so I want you to follow up with that, Johnathan. And am I right? Am I wrong? Tell me a little bit more about that.
No, you're right on point. And I'll tell you the truth. I'm a born again CPR advocate. I came up in a world where response times were terrible. Civilian training on the topic of CPR was pretty horrible. So the probability of me arriving on a scene, working a patient to a successful outcome was non-existent. It just didn't happen. Well, now we're at a time where the the instructions for CPR have now gotten so simple. It is literally aggressive compressions from 100 to 120 times per minute with a 30-2 ratio for everybody. So now that, everyone just knows, and everyone's seen the Office episode where they're doing CPR and it's the whole staying alive, and you can do that. We've reduced the complexity of CPR. When I started CPR, it would be like, it's this if they're this age or this weight, and then it's this, and then it's this if they're this small, and all this bullshit. And now we've finally shown civilians that, hey, if you're comfortable doing compression or doing ventilations, then it's 30-2. If you're not comfortable doing ventilations, then just beat them up with really aggressive compressions. So people in the civilian world are getting better at CPR. They're understanding that even if they don't do the breaths, they can do really aggressive compressions. Thereby, we're having a better patient outcome because we're circulating that remaining oxygenated blood in their body. Also, pre-hospital care is getting better, and so it's kind of a massive confluence of potential whereby the patient outcome is much higher. And I'm behind that. I mean, God, I teach, 1 or 2 CPR classes a week professionally. And it's a lot of fun. I like teaching the skills. I like giving people this empowerment to say, hey, here's how you do it. So the class you took was right on point. Civilians are getting better at it. They're not as worried about litigation. They're not as worried about the disease of having to do mouth to mouth and all that gross bullcrap. They're understanding if the only thing they can do is aggressive compressions, that's awesome. Also, we're seeing a lot of AEDs positioned in the civilian world. We're seeing them in grocery stores, in libraries, in workspaces. So AEDs are getting to these patients. So in situations where in the first minute or two we're getting aggressive compressions going and we get that AED in place, that's where we're getting those 50% survival rates. It's amazing.
Something else that I think should be mentioned is we see AEDs everywhere, but we also come to find out if you take a look at those AEDs, a lot of them are expired. So going through and for what that's worth, if it's a pad that are expired, it is what it is. But if the battery's shot in the AED, you're not going to be able to do much with it. So setting back a little bit of budget, don't buy that latest Staccato and go buy a $1,200 AED to keep around in your vehicle. That might not be a bad idea.
Yeah, that's a great point, man. I did a little impromptu survey, and when I wrote an article recently about civilian ownership of AEDs, because I came back from a big conference north of me for a dog, like a pet food manufacturer called IAMS. Most people have heard of that. I was doing their annual safety stand down, and I taught CPR all day to these people. And on the way home, I was talking to the owner of the company, who actually used to be a firefighter of mine in my company before he started this company. And I said, hey man, how many civilians are owning AEDs? Because I kind of feel like I've been talking shit in that I'm espousing the virtue of this amazing tool. And he's like, oh, we sell like 10 residential or privately owned AEDs a year. And I'm like, that's it? And I asked him a little bit more about pricing, and I immediately ordered 2. One is in my Forerunner that I go everywhere with, and then one is in my home. And like Frank said, if you buy from a reputable place, like where I teach for, they sell and install AEDs. If you buy an AED from them, they also put you in a database that tells them when your battery is going to expire, when the pads are going to expire. Because some AEDs, especially cheaper ones, the batteries and the pads are on a different expiration cycle. So a lot of people don't know this. I bought one where the battery and the pads are incorporated in the same cycle. So, but because of where I bought it, they're going to tell me that that, in 4 years I need a new pad or a pad battery combination. I bought pretty high end ones because I started asking some gun world friends, and I said I would just ask a buddy randomly, and I'll feel the same question to Jeremy and to Andy, and I would say to you, do you have something in your safe? Like, visualize your gun safe or your gun safes. Do you have something in there that costs between $1,300 and $2,000 that you could probably cope with not having if you could have an AED? And I asked all my buddies that, and all of them were like, oh, shit, yeah, you're right. I kind of do. And that was me saying, hey, if you or your loved one or a family member comes over or a friend, wouldn't you love the empowerment of knowing that you have this knowledge and you could do something about it? And they were all like, yeah, I would like that too. So that was kind of where I came at it from. And I immediately guilt tripped myself into buying 2 of the highest end AEDs on earth. So that's just me.
Yeah, and then he wrote me into it. For me, it was almost from a point of embarrassment, right? So, again, he invited him down to my church. He comes and teaches, real world trauma. We specifically asked a question about, educate us on this AED because, we didn't have good information. Crack this AED out and everything's expired by like a lot, a couple of years at least. And it's one of the things where like we're we have this tool here. We think we know that everything's squared away on it, and it wasn't. And that's since been taken care of really quickly. But and even then, that particular AED that we had there, purchased pads, purchased battery. A week after the pads and batteries showed up, there's a recall on the battery for something. So that is out in the public. That's out in the world. Am I going to trust my family's life on a tool that I don't know, the pedigree of, or I don't know that it's been maintained at all? I'm not going to take that risk. So, like I said, I'm going to live without that extra gun, that extra widget, whatever it is. And I went and did the same thing. So I have one in a vehicle that I ride around with, and I have one here at the house.
I'm so proud of you, Frank.
I learned from the best.
That's awesome, man. Well,
like I said, he guilt tripped me into it. It was one of the things where you would be ignorant if after taking that course, after spending all that time, after spending again, it was only 8 hours for the course, but he expounded on so much of the benefits of that. It would be ignorant for me to not take action. Yeah, and I know a lot of others in that same course are in the exact same position I was. That I had a conversation with them, but I'm sure that they went and did the same thing.
It would be the same thing as if Jeremy or Andy or Frank or myself asked any of the rest of us, if we were out in public and someone was like, hey, what gun are you carrying right now? And if one of us looked at the others and said, well, I'm not carrying any gun, I thought one of you would. That would be a bullshit answer that all of us would be like, whoa, man, your gun isn't my deal. Like, why are you putting this on me? What are you doing for yourself? And never mind that I'm a paramedic and, I've all this experience and everything like that. It's me pushing a button on an AED is no different than Frank or Andy or Jeremy or anybody pushing a button on an AED. Why do you have to wait for the government to come and put electricity into a body that needs it? Frank, you have young kids. Some of us have older kids. My boys are older and one of them's gone, but it's me, my wife, and my son. And if electricity needed to be put into the heart of one of us, why would I wait for the government at the end of 911 to be 12 to 15 minutes away to do it for me? Why would I do that? If for $1,000, $1,300, maybe $1,800, I could do it myself and get a totally different outcome, why would I not do that? That's part of the real world concept that I've tried to put together with this class. And that's where I'm at with all of this, is self-empowerment and self-reliance and to have the ability to affect a positive outcome where otherwise you couldn't do shit. I take that super seriously. And so I fixed myself with AEDs and have tried to help people understand the same.
That makes sense, man. And that's a good point. You got a $1,500 AR in your rifle next to your other $1,500 rifle that's next to your $3,000 AR rifle.
Yeah.
Right. What are you doing?
Exactly. That's where I'm at.
Hey, John, I know we talked about it, and I'm sure the listeners are probably tired of listening about AEDs, but
I'm sorry.
What are some good brands that are out there that are go to?
The one I have is the Heart Sign 450, and that's pretty much the top of the line that you can get. The next best would be, I think, the Heart Sign 350.
I got the 360p, I think.
I got the 450p. So any of those are going to be amazing. Those are great. The what's the green one? Crap. Oh, the crap. I forget the name of it. Heart Signs are the ones that are like the favorite for me. Zoll. There's a company called Zoll, Zoll, and they're pretty, most common AED is pretty well respected. I went for the Heart Sign because of portability. Because I do, anytime I'm teaching on the range, if I'm on the line or if we're running a class, I have a Heart Sign out with us. Even though we have I forget what brand is in the PD there, Xenia, but those are two great brands. Heart Sign anything and Zoll anything is great.
I was just over there looking at the what is it? AmericanAED.com. It looks like the folks that you got them from. You want to give them a shout out?
Yeah, it's Firefighter Safe in Dayton, Ohio. Firefighter Safe, and they are super helpful. They can go anywhere, or they can ship anywhere. They can take care of all your needs for any kind of repairs, replacements, supplies, and they are at. Let me get their website right. Okay. Excuse me. Firefighter. So they are at website, just as it sounds, firefightersafe.com. And they're you can call them anytime during the week, and they will get you set up with any, from the highest end to the lowest end AED you could possibly need. They take care of all of it. And again, that's Firefighter Safe in Dayton, Ohio. We also meet all of your confined space rescue in training needs. But nice. Another thing we do a lot in our class is preparing people for the needs after an auto accident. That's a big new module we've added to the class. And that's been a lot of fun. That was mostly inspired by our friend Phil Groff of Vigor Tactical. Or did I say that right?
Vigor Training.
Vigor Training, excuse me. Sorry, Phil. But that came about some work we did with him over the last couple of years. And I've been a vehicle extrication instructor for about 20 years. So we added a thing to the real world trauma class is how to understand cutting seatbelts and how airbags behave and breaking glass and the types of things going on in a vehicle crash. So we do that too.
Nice. Frank, what was your biggest takeaway from the course?
For me, it was, it wasn't really about me. Let me preface that by, again, I've said it a number of times already. This course wasn't for, just gunslinging dudes. It was for average everyday people. And the biggest thing that I took away was, John's ability to be able to relay that information so that an average plain Jane person could understand it. he covers a lot of different things. He covers a lot of different ways of going about handling trauma. And I'll be honest, some of the imagery and things like that, again, has real world application. I was super hesitant with his audience. And when he started that segment of showing real world trauma, I'll tell you what, there's a couple of little ladies in there I thought were just gonna pass out. We're gonna practice some real world CPR like right now, like we're gonna see how this is gonna work out. And they were rooting him on. They're like, "Yep, that is such." I mean, they're really going through and doing some. They're really were involved, and I think his ability to be able to relay that information it was, and me being able to I steal from every instructor that I learned from, or every instructor that I take a class from. I'm able to go through and say, okay, that's a neat way that he explained that. That is now mine. I'm gonna steal that. I'm gonna share that with somebody else. But his unique ability to be able to go through and share information and dumb it down so that the average person now has confidence and competence to be able to render aid. God forbid they needed to. That was really something. Again, I don't want to give any secret sauce or anything like that away, but the way that he goes about teaching like wound packing, that worked phenomenally well. And the simple tools that he had, simple tools that he was able to use to illustrate wound packing were super effective. It lent well to the audience that he had, went well to their people that were in the class. They were able to get it. And I'm very confident that to this day that they, even though the class was, some time back, they would be able to pick it right up and run with it.
Let's talk about that a little bit more. John, what are some drills that you use, tools that you use to have students work through wound packing, working on how to apply a tourniquet? Oh, you're on mute.
I'm a big dummy. There we go. So tools that I like, I've taught everything from the most advanced moulages and all that stuff to the most basic. And truthfully, like with tourniquets, I think the best thing to do is much like learning to run a pistol. You learn to run, strong hand and then weak hand, and you do all these different things to cover all the contingencies you possibly can. So with tourniquets, I like to literally throw out tourniquets to every person in the class and run drills. We run drills when we go, and we like training a draw stroke of a pistol. We start and it's 1, 2, 3, 4. We go through those numbers. I like to teach tourniquets with almost for lack of a better description, a numbering sequence. And we do that very simply, very slowly. And then we ramp up speed, and then we switch hands, and then we go from arms, the one-handed applications to each arm, and then we go to the legs. And then by the time they're getting to the legs, it's super easy, and people are knocking it out in 15 to 30 seconds, no problem. So that's a big thing. That's my favorite way to cover tourniquets. I've seen, and I've actually been mandated to teach it with using these props and all this bullshit that they're like, oh, we're going to run blood through it, so it's going to seem so realistic. And if you've ever done this on a real human form and then you've done it on a prop, you're like, yeah, bullcrap. I would have rather had more reps just on myself or on another person, just getting the mechanics down quickly and effectively every time, than having to mess around with some prop and some stupid crap like that. So I'm not real big on the bloody props and stuff like that. I actually had to teach a lab last week where I had to run blood through a wound packing scenario. And Frank will tell you, I actually built all my wound packing props because I like them better. I find them vastly superior to anything I've spent or been forced to use that cost hundreds, if not thousands of dollars. So that's my big thing. It's theatrics in a lot of ways to squirt blood through something and be like, oh yeah, you did the thing. No, you can't. You didn't do the thing. I'd rather you really, really learn it with kind of that's how I've learned better. And that's how I think I've helped my students retain more information such that they could adapt to the dynamic environment of a traumatic injury. I believe that to the core of my being, that what I'm doing with the props I've built and with the training reps we do, that it's a better product.
Yeah, we took a class. The class that we took, they simulated. They put a wound in a pork shoulder, pork butt, and then and they pumped some blood through there. So that was always interesting. I've seen people do like tourniquets on pool noodles, and for me, I'm just like, that doesn't. Why not just put it on yourself? Put it on a buddy. You're not gonna.
I like doing it on yourself because it helps people understand. And the caveat to that is, in my drills, I have them put it on themselves, and I reinforce that the first step of any proper windlass tourniquet application is the most aggressive tightening you can do manually, right? So in our training environment, I only have them do a half turn on any windlass and then set it in. What that does is it reinforces the importance of that first tightening stroke on either their soft T or their cat or whatever. And then it shows them, even if you've done it right with the first step, that half turn is going to be pretty damn painful. So it helps them understand that cats are going to be, or tourniquet use in general is going to be extremely painful for the recipient. And they're not surprised by that as an administrator of the tool. That's a big thing. I think helps a lot. If you felt that pain, and I felt that, a lot of us have done it to the point where we have to isolate pulses before it's considered done. That runs a risk for some of our patients or for some of our students, because some of them are older and may have vascular issues or may have had, any number of reasons. If you're going full Monty on the freaking tourniquet, it can be bad. But I like them to learn it on their own body, and then they can understand how excruciatingly painful it is to put a tourniquet on or have one put on you. That's a big thing. Like, I'm with you, Jeremy. I do reps on yourself, do reps on other people, and feel it for real.
Now, for me in my house, yes, I'm a huge proponent for teaching kids. I'm a huge proponent for teaching kids all things self-defense, stuff with firearms, medical. So for me, me in my house now, I have a 6-year-old, soon to be 7-year-old daughter, and we have this blue training tourniquet, and I'll throw it on the floor and say, I got a femoral artery bleed, go. And the little 40-pound soaking wet girls throwing a tourniquet up my leg and using all her weight and putting it in. For her, it's fun because she gets to hurt daddy. But it helps reinforce some of those skill sets, and helps reinforce some of those things that for her it's a game, but maybe one day it won't be. Maybe one day she'll have that skill set to be able to go through and apply that. And same thing with stuff that we do on the range, or with other students, things like that. Like I had mentioned before, tourniquet use is one of the first things that we educate our students with, and going through and practicing that, testing that. Those are all really good things that, honest to God, I think if you carry a gun, you really need to understand what it feels like. And you need to practice that just like you practice, reps out of your holster or whatever else it may be.
I've talked to people who've had the tourniquet put on them in the real circumstance, and a lot of them have said that it was way worse than the initial injury. And that's a pretty shocking reality when people understand that. I don't know. There's just something to me that is important, that we're talking about in real world trauma and all the other portions of the class, the fact that you can affect a positive outcome on the single most controllable means by which civilians die from trauma is a big deal. And tourniquets are where it's at, man. Everyone's off in the weeds learning this, that, or the other thing and thinking they need this, that, and the other thing. But tourniquets are where it's at. Like, be great at that.
Yeah, it's a $30 piece of gear, like a cat. What generation are we on now? Cat, is it Gen 8?
Gen 7.
Gen 7?
Yeah. I think on the soft, I think it's 5. I get confused on the soft because I hate the new one and I like the one before it. So,
what generation rats are we on?
0.
Generation garbage can.
I'll shit on that party right now, dude. I do not apologize for any of that. Like,
what are you talking about? That's the tourniquet that's included in the USCCA trauma kit, dude.
Are you shitting me?
I shit you not, man.
No, it's not. It is.
It is.
Oh,
And that's
God.
We were talking on our last episode or the episode before, we were talking about the different, multi-level, like the instructor multi-level marketing companies out there.
Yeah.
And I was intrigued because I'm like, hey, it's maybe, a national program or some kind of standardized trauma course. Right. And then I saw the kit that they were putting out and I'm like, this is absolute garbage.
Man.
This is hot garbage. What are you?
It's a funny thing, man. I get stuck because even, Frank and I have a mutual friend who came to me one day and was like, hey man, what do you think of this tourniquet? And I was like, I've seen it around. I'm slow to change. So if I know that everyone I run with runs soft T or cat, period. That's what they run. And a friend of ours came up to me about another one, was like, hey, what do you think about this? And I said, you know what? To be honest, I don't have a lot of hands-on. So I went home the next week and I ordered 2 of both of the kinds that this company sells, and they were utter dog shit. I mean, they were absolute garbage, and cost the same as a soft T or a cat. And I was just, for the life of me, I couldn't think of the why. I couldn't think of why this was a thing. It was clearly just a market share attempt, and it is what it is. But man, Jeremy, I'll tell you, with all these tourniquets going around, I spend so much money on just buying bullshit tourniquets. It sucks. Because I have to be able to speak intelligently about them, and I have to buy them so that I can throw them out to my students and say, okay, here's this thing. You're going to do this with this. You're going to do this drill with this tourniquet this time. And as soon as I do, they're like, that sucks. I don't want it. Give me the other one back. But it's a responsibility, man. And if you put a cat or a soft T or a SWAT or a old TK4 or a snake staff or whatever the hell you put in front of people, they're going to have their preferences, and their preferences are going to be one of 2 universally, like period. The SAM tourniquet, they're going to throw away that SAM tourniquet and grab a cat, or they're going to throw away that that snake staff and they're going to grab a soft T. It's the reality of the world. The soft T and the cat are the best tourniquets for a reason, because they actually save lives and they're actually usable for the end user. So that's what's up.
And they're simple to use. Like you don't have to think about it.
Yeah. I find Andy, I think you brought up the rats. I find the rats to be absolutely freaking offensive from an end user standpoint. I mean, if you've ever been with someone who's bleeding to death and you think the rats is a good idea, then that's the shit for you. Like, that's the rats is what you should go for. Like, have at it. Enjoy yourself. I'm not about that shit.
So let me ask about that real quick on this rats, right? Because, for adults, I agree from what I know, and my experience is limited. But one thing that we learned about rats is, like, for small children, dogs, stuff like that. Mm-hmm. Would you agree that it's still garbage for that as well? Or what are your thoughts on like small children?
For small children, well, one, there's the small child enough that people don't understand how truly small of a child you can use a cat or a soft T on. Now, don't get me wrong, I hate the soft T. Like, I hate it. But it's an amazing tourniquet that a lot of great people that I know that have been in the streets and in this world of work have really used. So I'll give it, hey, that's for them, cool. And truthfully, if it's only me administering it to another, I still love the soft T. So I can't let people not think that a cat and a soft T can't be used on a very small child or an animal. Okay. To dive deeper into the small child or animal discussion, dude, I love the SWAT, the stretch, wrap, and tuck. It's like, I don't like it as much if I have very bloody hands. It's a little bit more difficult to work with if I have bloody hands. But generally I can control that environment because it's not my blood, so I can wipe it off. So I can use the SWAT T on a smaller person. I like the old TK4s more than I would ever consider a rats. So there's been I wrote an article a few years back on categories of tourniquets, and it was primary, which are windlass based tourniquets, secondary, which are elastic compression based tourniquets, and then field expedient, which are all bullshit. And like mythical creatures from Cub Scouts and Boy Scouts days. So there's some what we would call secondary tourniquets that I think are really good, and that would be my two favorite are the TK4 and the SWAT T, or not the SWAT T, the stretch, wrap, and tuck, the SWAT. Those are huge, incredibly good for small creatures.
Yeah, I was just reading because I wanted to see, what's the smallest diameter, and they were talking about it's a study. I'll share the link in the comments or whatever. Mm-hmm. And they were talking about the windlass. How the SWAT T was successfully tightened over all sites of all CPR mannequins except for the infant. So it is one of those things, and it looks like the general age of efficiency for the cat or the soft T would be 5 or older, just from what I read briefly. Mm-hmm. So,
yeah, when we get into the smaller diameters, we're getting into the weeds of extremes. But yeah, that's a fair statement of fact that they will write down. Yeah.
Yeah. What else? I hate asking this question, but I feel like this is such an important topic and such an important class. And we're an hour and a half in, and I feel like we could easily talk about the rest of the course for another 6 or 7 hours. What other information have we not covered that you would like our listeners to know, to hear?
You're asking me, Jeremy?
Yeah.
I would say my biggest hurdle for this class and my biggest goal for this class is to get to more wives. And I use that generally speaking because most of the people who come to the class are the male shooter that this came to kind of organically. What I struggle with in this class that I know the class is perfect for is spouses and any able-bodied and able-minded teenager. My biggest goal and my biggest hurdle simultaneously are to get more of those people into the class, because most people see that I teach for a company called Gunset, and most people who know me as a gun guy, even though I teach all these other things and have for 20 some years. That's the thing I would like people to understand, is that this class is written from the ground up, even to the point that Frank was mentioning the imagery that I use extraordinarily graphic imagery. Not one of the images, I take that back. There's a stabbing. I don't use gunshot imagery. And I've adapted the visuals to be 100% things that would be organically present in your goings on. Cars, hiking, boating, and things like that. I want people to understand from this class that this is a class that for every shooter I know that thinks about taking it, I'd like to see 1, 2, 3 non-shooters, because like in the example of Frank's church, or every church almost in the United States, we have guys or ladies who are willing to take on the risks of the safety of that flock, right? Not everyone's a shooter, but everyone can be the first of first responders to an injury or an illness or a traumatic event without a gun. And that's one of the things that has been the most difficult about doing this. Is I believe in every bit of what I teach to the core of my being, but it's hard to get people to understand this isn't about tactics. This isn't about shooting. This isn't about being a gun guy or a gun girl. This is about being a human that can affect a positive outcome in the worst event that they could possibly imagine. And it might just be driving down the street or something like that. That's what I'd like people to know about this class.
Very well said. I'm going to kick that same question over to Frank.
I've already said it. I'm honestly, I'm going to mirror the exact same thing John said. Being able to get this information, it's quality information, out to the average Joe, the average Jane that's out there. I think that is where this course is best served. Not to say that you're not going to learn something. You're absolutely going to learn something. But this is the type of class that those non-gunslinging friends, or those people who are like, I'm not really into that. I'm more into whatever it may be, my gardening. Then this is the type of course I think that would best suit them. This is a fantastic introduction to the world of training, the world of self-reliance, the world of self-preservation in some aspect. Because John does a good job of, especially in the beginning of the course, diving into staying safe. What does that actually look like? Is the scene safe? How do you identify things like that? And so taking that spouse, that loved one, whatever may be, that friend who's not really in that realm yet, I think John's course for rural world trauma would be an excellent catalyst to the rest of their journey if they decide to take that.
Nice. I'm going to kick it over to Andy. Your final thoughts, and then we will give these folks their evening back, our listeners their evening back. I know Johnathan and Frank are a couple hours ahead of us.
Yeah, Johnathan, I have one more question, just based on the training March protocol. Is that something that you use, or what do you use in place of that if you don't?
I hugely follow March protocol for sure. Massive hemorrhage is always the first focus, and I actually talk about that in my CPR classes, man. But yeah, March is actually the outline of my class, with the exception of CPR. My class flow is massive hemorrhage, airway, respirations. Circulation happens kind of early because of the CPR module, but with the revisiting, and then hypothermia and the exceptions of the H component after that. So I strictly adhere to March because I think it's civilian palatable and easy to understand and remember.
Awesome. Yeah, I agree with that. That's something when we took our course, I went home just repeating March protocol. So I had it in my brain from here on out. And, Jeremy mentioned I rolled upon a motorcycle accident, and that's the first thing that came in my head was remember March, and started going through it. Luckily, there was an EMT that showed up that had much more experience than I did. So I was just kind of back up and helping him. But one quick thing, this guy pulled out a whole med bag, and he was putting an IV in the guy. And right when he went to put the needle in the guy's arm, I was like, "Hey, do you have rubber gloves?" And he stopped, and he's like, "Oh shit, I don't have rubber gloves." And I was like, "Here, I got some." And I threw them out of my IFAC, and I was like, I finally did something, but it was cool. And it was a fun experience for me, obviously, as to be able to get my experience and actually utilize it. Obviously not fun for the person that was laying there, but it was a really good experience. Everything we've talked about tonight, as Jeremy mentioned, we could probably spend at least another hour on all of these things because there's so much there. And I appreciate both of you guys coming back on. John, I missed the last podcast you were on. I was out of town or whatever it may be. But I'm glad I jumped on this one because this one hits close to home. And if you're somebody that watches our show and it has not hit close to home, you're missing the boat, is what I think. If we haven't covered that enough, go back and watch this podcast from the part where Johnathan and Frank starts talking about the importance of not thinking about this in a gunshot world and just a really everyday world. And go out and get some medical training. Find it somewhere. I don't know if Johnathan, if you guys travel or anything like that, or if somebody will be willing to travel with you, I'd like you to let us know where we can find both of you, not only for this training, but all future training. And my final thank you is, I appreciate you coming on the show.
Thank you so much for having me. You can find me, and we absolutely do travel. You can find me at Gunset Training Group, traingunset.com, or my personal website is trainwithwillis.com. And we absolutely travel and love to get out and make new friends and put out this information to people all over wherever we can. So I'm pretty easy to find, pretty easy to track down.
Where can we find you, Frank?
So Apache Solutions. So it's ApacheNC.com. And we have both the Eventbrite, all, YouTube and Twitter and Facebook, all that fun stuff. But it's Apache Solutions LLC, or at Apache Solution LLC. And earlier we had mentioned Greg Elefitz, right? His System Collapse Medicine course. We're actually hosting Greg in October. So October 15th, it's a Sunday. He's teaching his tactical first aid systems collapse medicine at Apache, and that is a fantastic course.
I tell people, sorry to interrupt you, Frank, but
yeah, you're good.
Greg is one of my favorite instructors on these topics who's not me. Now, Greg goes into a different I love what he does so much because we're very different in our classes. You could take my class and then his class the next day, and you would, with almost without exception, you would not cross paths. Like, Greg goes in some totally different directions. I tell everyone, Greg's Systems Collapse Medicine class is a mandatory run, period. He is one of the best people I know putting out this content, and he was a freaking cop. So mad love for Greg. He's a good friend, and I love everything he does. I actually dragged a mutual friend of Frank and mine, Scotty Cronin, who is the owner-founder of Gunset. His first trauma class, or his first medical class, I'm like, you're going to freaking Elefitz. I drug his ass up to Northern Ohio to take Elefitz's class before he'd taken my class. So, yeah, take that Elefitz class. If you can hit it in Apache, that's what's up. You can also hit his Snubby Revolver and maybe his Extreme Close Quarters, or is it?
That's
not?
exactly it. Yep.
Yeah.
That's the exact same weekend.
Yeah. Yeah. Get over to North Carolina for that.
That's right.
So I have homework for both of you because I did TACCon 2 years ago, going next year.
Giddy up, yeah.
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 We'll see you there,
it's
bro.
awesome. It's great. Oh, cool. Then I'll have to run over there and bug you guys. Are you
Please
teaching
do.
or are you students?
So
you can't say. Yeah. Never mind.
Frank maybe have a different discussion, but I don't know.
I don't know what you're talking about.
Yeah.
I don't know. I don't know either.
We'll stop right there because if I remember last one, those haven't been released yet.
No, they
Anyway,
haven't.
so I did Ella Fritz's Traveling to Dangerous Places seminar, which was really, really good. Walked up and I was like, hey, Greg, really love to get you on the podcast. Jeremy's reached out to him. Hey, Greg, really, and he's like, nah, I don't do podcasts. So my homework, he is. So Johnathan, you're friends with him, and Frank, you're about to host him. So your homework for us is to go drag him to After Action Project and maybe hang on one of his gorilla arms. I don't know what you got to do.
I don't know what to do for that.
We got to get him on the show.
Good luck.
Yeah.
We'll see what we can do.
I think people are trying to get him on freaking Rogan.
Yeah.
Yeah.
But
Yeah,
love
he's
the
a
dude.
nobody.
Like he does amazing work, and I sorry to prolong things, but I took his Kubaton or his small impact weapons class at last year's TACCon, and we beat each other's up with Kubatons and all this stuff for a couple hours, and it was a great time. So, Andy and Jeremy, are you going to be at TACCon next year?
No, I won't be there.
Well, Andy, we'll see. Frank and John will see you there.
I might kidnap Andy and take his spot. We'll see.
Jeremy doesn't like to go to training classes with me. I don't know why. I don't know what.
Hey, we've signed up for 2 or 3 classes together, and you've had emergencies or something. He got this thing, COVID. I don't know if you heard that. COVID when
What's that?
yeah, exactly, that made up thing.
That doesn't even sound like a thing.
Suit.
Yeah. And then for Tim Herron's inaugural course here in Albuquerque, he signed up. And what happened with? Oh yeah, that was you had a loss. So
yeah.
That was a good reason to miss it. So, hey, I want to give you guys the rest of your evenings back. I really do appreciate the conversation. Here we are, an hour and 45 in. It was a great conversation, a ton of information. So I really do appreciate y'all jumping on and giving us your time and your knowledge. Want to thank all of our listeners for jumping on, our viewers for jumping on with us. Remember, it's your life, it's your safety and protection, it's your responsibility. We will see you not next week, but the week after. Y'all stay safe.